Good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikelu. But first, the highlights. Zamfara State inaugurates COVID-19 Action Recovery and Stimulus Program, codenamed CARES, to cushion economic effects of the COVID-19 pandemic. And the Jigawa petty trader narrates his experience since the COVID-19 lockdown. The World Health Organization says COVID-19 death toll could be 2 to 3 times above reported numbers. The United Nations Secretary General Antonio Guterres is worried that the worst is yet to come with COVID-19, especially with unequal access to vaccines and health equipment which poorer countries have to contend with. The solution to this, he says, is a global coordination of response because no one is safe until everyone is safe. Over 80% of the world's vaccines have gone to affluent countries compared to the 0.3% which low-income countries have to make do with. Well, he was speaking to G20 world leaders at the 2021 Global Health Summit, where, as you would expect, COVID-19 formed a major part of the conversations. Well, in the meantime, so much has happened in the past 24 hours. So here's what you need to know about the COVID-19 trend.
The first phase of the vaccination exercise has seen over 1.8 million Nigerians, representing 94.2% of the target population, vaccinated against COVID-19 so far. According to the National Primary Healthcare Development Agency, more than 50% of the target population in Cross River, Ekiti, Kwara, Lagos, Gombe, Zamfara, Rivers States, and the FCT have received the first dose of the Oxford AstraZeneca vaccine. Additional dose of the AstraZeneca vaccine, which requires 2 doses per person to gain full protection against the virus, are being distributed to states, some of which have commenced the second phase of the vaccination exercise. 49 new infections in the last 24 hours have brought the total number of confirmed COVID-19 cases to 165,901. According to the Nigeria Center for Disease Control (NCDC), the new cases are from 6 states and the FCT. Lagos has the highest number of 21 new infections, Rivers has 16, and the FCT has 5. Kano recorded 3 cases, Akwa Ibom 2, while Ebonyi and Ekiti states recorded 1 each. Plateau, Nasarawa, Ogun, Osun, Oyo, Ondo, Kaduna, and Sokoto states recorded 0 cases in the last 24 hours. 3 people have been discharged in the last 24 hours after testing negative to the virus, raising the total number of recoveries to 156,459. There have been no deaths from COVID-19 complications since May the 17th, leaving the fatality toll at 2,067.
Good morning, ladies and gentlemen.
The Senate Committee on Health has been throwing light on the state of COVID-19 intervention funds, stating that only 50% of the funds have been released so far, and the upper chamber will ensure its effective utilization. Globally, there are more than 165 million cases and over 3.4 million deaths reported, while over 1.5 billion vaccines have been administered.
And out to Zamfara State, where Governor Bello Matawalle has launched the state's chapter of COVID-19 Action Recovery and Stimulus Program, known as CARES. Well, CARES is a stimulus program conceived by the Nigeria Governors Forum and introduced in all the 36 states of the Federation, as well as the FCT, and being implemented with the support of the World Bank. Governor Matawalle says the program will deliver over 8 billion naira through special or social transfer, livelihood grants, provision of basic structures, support to medium and small-scale enterprises, and more.
Our strategy is to focus the program on those who are directly affected by the COVID-19 pandemic, especially the poor and vulnerable segment of the Zamfara population. The program will accomplish this through social transfer, grants, provision of basic structure, support to medium and small-scale enterprises, and ensuring food security that is threatened by armed banditry and a general economic downturn. The services that CARE will deliver to the common man of Zamfara State are: 1. livelihood grant of 3.4 billion naira. 2, food security, 3.4 billion naira. 3, job creation through MSCs, that is 2 billion naira. Apart from the Zamfara Cares for You program steering committee, we are also inaugurating Human Capital Development Council this evening. Formation of this council is a result of the resolution by the National Economic Council. The Human Capital Development Program consists of 3 components, namely health and nutrition, education, and labor force. The program targeted to achieve 24 million additional healthy, educated, and productive Nigerians for a globally competitive nation by 2030. This is aimed to provide equitable access to affordable and quality health care for every Nigerian.
The lockdowns may have been eased in Nigeria, but it will take some time for the millions whose livelihoods have been affected to recover. We follow the story of a 70-year-old in Jigawa State, Garba Ahmed, who lost almost everything to last year's lockdown, which saw markets and other public places closed for weeks. Our Jigawa State correspondent Sadiq Ilyasu brings us the story.
Jigawa, like other states in Nigeria, was hit by the COVID-19 pandemic. To control the spread of the virus during the first wave, the state government locked down the capital and put restrictions on business activities. Malam Garba Ahmed is a 70-year-old petty trader in Limawa, an outskirts village in Dutse, the Jigawa state capital. Before the pandemic, his shop was full to the brim. Now he has nothing left after going through an over 2-month lockdown. I used to have lots of things in this shop, like detergents, sugar, cream, rice, beans, and flour. I lost everything. I sold my farm, 140,000 naira, and reopened the shop. But people came and bought things on credit and could not pay back. I have children, a family. Nobody will lend you money to start your shop again. I was eating 3 times a day, but now we just have to eat once a day because of the situation. The state coordinator of Save Nigeria in Jigawa, Mariam Ibrahim, believes Garba Ahmed is just one among many who were severely affected by the pandemic.
Now, you do not have anything to have a return on capital. So for that reason, they have to feed on the capital. Even though there are assistance given by the state government and the federal government, but it's not enough.
Experts believe that the economic impact of the pandemic may affect the nutrition of children in the state.
You don't have what you even eat. Regardless of having a balanced diet, regardless of thinking of maybe the nutritious value of a food is there in it. You are only looking for a food to have in your stomach.
Cases of infection are declining, but effects of the infection on the lives of people may take longer to decline. Relevant government authorities, private bodies, and well-meaning citizens may come to the aid of the less privileged in society, but it will take a while for them to recover from the effects of the COVID-19 lockdown.
I mean, you may be wondering, whatever happened to the COVID-19 intervention, stimulus, or survival funds, which essentially meant to help ease the hardship faced by millions like Mr. Garba Ahmed in Jigawa State and, of course, boost the health sector? Well, yesterday's revelation by the Chairman, Senate Committee on Health, Senator Ibrahim Oluriegbe, that only 50% of the COVID-19 intervention fund had been released so far brought up some more questions. And to give more insight into the spendings for COVID-19 so far and how to ensure that these funds are well utilized, we have joining us Senator Ibrahim Oluriegbe this evening on the program. Thank you, Senator, for joining us. I see you are on the move, so we'll just try to make this work. I mean, the story we just saw represents the reality of many. Is it that the funds will never go round or something is wrong somewhere?
I think the fund you are talking about is not within the purview of the Health Committee. I think that one was under the Social Investment Program. And that was not the one I was referring to during the press conference. I was referring to the fund that's the health intervention component of it. I don't have information on the quantum of release as far as the social investment part of it is concerned, which will be able to address the issue of the Nigerian that you focus on, is from the Jigawa state. But the one for the health sector, just like I said during the press conference, 50% of those ones that are meant for the infrastructures have been released. There are part of it, just like I mentioned, which are fully released. And there are parts that are yet to be utilized, particularly the one meant for local production of vaccine. So direct your answer to your question, the funds that are social investment, I think it should go around, and I think a substantial part of it has been utilized based on my information from other sources. But as I said, I'm not in charge of that. I'm not a member of the committee social investment.
Because, I mean, when people hear about COVID-19 funds, it all comes together. But there's a general sense that COVID-19 spendings have not been transparent. I know you've been doing some work which you spoke to yesterday during that press briefing. So haven't done some level of oversight. Do you feel that way too? Do you feel that maybe these funds have not been judiciously spent, or the information is not just out there enough?
No, I think it's rather the second part of your question is the information. I think in terms of being utilized, it is being judiciously utilized. In fact, it's not only us, even the executive arm is also conducting monitoring to ensure that it's effectiveness and efficiency. Because part of what is causing the delay in the release of the second tranche for those ones that are meant for the health sector is that the Ministry of Budget and National Planning set up a monitoring committee to go around all the health facilities that were beneficiary of that, the first tranche of release, to see how the funds were utilized. They visited the hospitals. I was aware when they were in National Hospital, in the FMC, the one close to Abuja, that's a Kefi, as well as they now travel to all those ones in the South and the Southeast to be able to look themselves that the funds is utilized. On our part as committees, we have been monitoring, we have been following up with these institutions. I explained the various components of the fund. The other part of it, which is based on our oversight also, like the one meant for COVID-19 vaccine, it's not COVID-19, meant for stimulating the capacity of Nigeria to produce vaccines. We actually conducted oversight visit, and public hearing was held on it, to be able to see the vaccine facilities and to be able to have information on how that fund will be utilized. And based on that, we made a recommendation, which the Ministry of Health will now follow. So in terms of efficiency in the utilization and effectiveness, I think we are doing well.
So, Senator, if you could put a figure to the 50% which you say has been disbursed, just how much is that? How much is being expected?
It's various components. I mentioned it yesterday. The one that is 50%, there were the one for infrastructures in the hospitals, which is one, the molecular laboratory infrastructure, which we are putting in 52 tertiary centers. The total cost about 17 billion. About 8.6 billion of that has been released. And that's the first tranche, which is the 50%. Second part was the 50% for the construction of a 10-bed ICU center in each of those 52 facilities, as well as 30-bed isolation center. I think the total cost for that is about 8 billion. About half of that has also been released. Then the fund for NAFDAC, Nigerian Institute of Medical Research, NIMA, Nigerian Institute of Pharmaceutical Research, NIPRIT, which are to do the capacity of this institution for them to be able to conduct research on not only COVID-19, but other diseases that are related to that, as well as for NAFDAC to be able to have facilities for testing vaccines and to be able to support any effort that will ensure that Nigeria is able to produce vaccines. Those ones were 1 billion naira that were released to them. And those have been utilized. We have information on them, be able to ask for questions on that. So those are the ones that I mentioned. The one that is meant for vaccine production, which is 10 billion, that was released to the ministry, but it's not been utilized yet. Because as I said, we conducted thorough oversight on it, and we found out that there's need for some further actions to be taken by the ministry. So that has not been spent. That's fully released. That's not 50%, but it's not been utilized.
Well, Senator, I do hope that you'll also be pushing. Oh, yeah, absolutely. I do hope you'll be pushing for a central point where all these spendings, allocations, disbursements, and utilization will be captured. But would like to thank you so much for sparing time to speak with us on this topic. Senator Ibrahim Oluregbe is the Chairman, Senate Committee on Health. He's on the move, and he took time out to speak with us. Thank you. Well, we'll go on a break now, and when we return, we'll bring you an information on what's happening in some other states, plus the foreign scene, especially with the green certificate, which will need to be presented in EU countries. To join us again. You're welcome back. Let's now bring you a quick look at what's happening in some other states. The Rivers State Primary Healthcare Development Board has been given the second dose of a COVID-19 vaccine to residents of the state. The board is urging qualified persons to visit the same vaccination point they took the first jab in the 23 local government areas with their green cards and to be vaccinated with the second dose. Now, as a reminder that a resident is qualified for the second dose after 6 to 8 weeks of taking the first jab. And over to Sokoto State, where low turnout of people has delayed the second dose. The Primary Healthcare Development Agency, through its PRO, Malam Zayanu, says no date has been fixed for the second phase of the AstraZeneca COVID-19 vaccination in the state, as over 10,000 persons are yet to be vaccinated. According to him, efforts are being made to mobilize people through media campaigns, and that as soon as the target is met, a date will be fixed. Well, I said outside Nigeria, where the countdown to the busiest summer holiday season continues in Europe, but travelers will need to have an additional document on them, the green certificate. Well, DW correspondent Chelsea Delaney joins us from Berlin for more on this. Well, Chelsea, the EU has agreed to open its borders to foreigners who have been vaccinated against the coronavirus. What does this mean for travelers around the world?
Well, many travelers will be able to come to the EU for holiday for the first time in more than a year. EU ambassadors this week agreed to two big changes. First, people who have been fully vaccinated should be able to come without having to quarantine or take tests. This is going to apply for vaccines that the EU's drug regulator has already approved. That means Pfizer-BioNTech, Moderna, Johnson & Johnson, AstraZeneca. The EU also has agreed to allow people who haven't been vaccinated from countries that it considers safe. So the threshold it's set for that is 75 infections per 100,000 residents. The EU is expected to release this new list of safe countries in the coming days, so that's going to be crucial to watch for people who are hoping for a European summer holiday.
Right. Now, one of the biggest open questions in the EU is its proposal to create a vaccine passport. Now that EU lawmakers and member states have agreed on this new travel pass, how did they agree and how will this work?
So the EU did reach a deal on a vaccine certificate last night, and it hasn't been an easy road. It took 4 rounds of intense negotiation, and countries are still very divided on what this is going to mean. What we know so far is that they will move forward with this digital certificate. It's envisioned as a smartphone app with a QR code that can be scanned to show if someone has been vaccinated, but also if they've had a COVID test or recently recovered from the virus. People without smartphones can also get a paper certificate. And the idea is that this will be usable across the entire EU and allow people to travel again easily. I would note that this is very focused on easing travel for Europeans. So while the border reopenings we discussed earlier are focused on foreigners, this is really focused on EU citizens. And one of the big sticking points we've seen has been what privileges these passes are going to allow. At the end of the day and at the end of these negotiations, while all EU countries have agreed to recognize these certificates, they still have the right to decide for themselves whether people have to quarantine or test upon arrival to the EU.
So finally, EU citizens have expressed concern that vaccine passports will compromise their data privacy. What steps are being taken?
Well, Well, many people are uncomfortable with the idea of having their health information stored in an app that can be scanned or seen by different country authorities, different businesses. The EU has been trying to address these concerns, and they've been stressing that they're only going to collect necessary information, so names, vaccination status, birthdays, and that it will be stored on a decentralized network like Bitcoin, for example, and that it won't be easily hackable. They've also said that they plan to shut down these systems after 12 months, assuming that the pandemic is under control then and that there's no further need for these certificates. But there also is a big ethical concern about whether these types of passes are fair, whether they're fair in allowing some people to have special privileges if they've been able to get vaccinated while others haven't yet through no fault of their own. The EU has said that's not their goal to privilege one group over another, and that's one of the reasons why they're also considering negative tests as a prerequisite for quarantine-free travel. And to that effect, yesterday, the EU also agreed to spend about 100 million euros on coronavirus tests to help make those cheaper for travelers, and that could help ease the financial burden for those who haven't yet had the chance to be vaccinated.
Well, thanks for that update, Chelsea. Still on the foreign scene, the World Health Organization says official totals showing the number of deaths directly or indirectly attributed to the COVID-19 pandemic are likely to be a significant undercount, as about 6 to 8 million people may have died so far. The Global Health Agency was revealing its statistics report estimates during a virtual press briefing in which it said that total deaths from the COVID-19 pandemic in 2020 were at least 3 million last year, or 1.2 million more than was officially reported. In fact, official estimates show that around 3.4 million people have died directly as a result of COVID-19 by the month of May this year. Dr. Samra Asma, the WHO's Assistant Director General in its Data and Analytics Division, was given the update.
Preliminary estimates for global excess deaths attributable to COVID-19 for 2020 stands at 3 million, which is 1.2 million more than official figures that were reported until December 2020. This aligns with the similar estimates, which all predict that the total deaths are at least 2 to 3 times higher than officially reported. So I think as the pandemic is still unfolding and we are seeing increased deaths in Latin America and in Asia, particularly in India and Nepal, pandemic is unfolding. So we will have better estimates, but I think we are safe to say on the lower bounds that what we are seeing today, 3.4 million deaths, this number truly would be about 2 to 3 times higher. So I think safely about 6 to 8 million deaths could be an estimate on a cautionary note, with a cautionary note.
Well, don't forget to protect yourself because the virus is still very much out there. Continue to take responsibility and visit our websites, channelstv.com, for a better understanding of the pandemic. We also have all the big stories for you, from politics to business, sports, and so much more, all at your fingertips. Well, that's the COVID-19 update for today. Thanks for watching. I'm Kayode Kikilu. Do stay safe.